What I'm about to show you may change the way you start every single morning, because the first minute after you wake up is not as harmless as most seniors think. In fact, for the heart and brain, it can be one of the most unstable moments of the entire day. And when I reveal the one routine millions of older adults still do before their bodies are ready, you're going to understand why some people feel dizzy, some feel chest pressure, and some suffer a heart attack or stroke before breakfast is even on the table. Please subscribe today for clear senior heart advice that protects your mornings, your blood pressure, and your peace of mind. I'm Dr. William Elliott, and I need to speak to you very plainly today. If you are over 60, your body does not wake up all at once. Your eyes may open in a second, but your circulation, your blood pressure, your nervous system, and your heart do not. They need time to catch up. And the mistake millions of seniors still make every morning is acting as if the body is instantly ready for full speed the moment consciousness returns. It isn't. That gap between waking and physiological readiness is where the danger lives, and most people have never been warned about it. Let me tell you about Leonard, because his story explains the problem better than any medical chart ever could. Leonard was 76, active, disciplined, and proud that he never wasted time in bed. The second he woke up, he would throw off the blankets, swing both legs out, stand immediately, and hurry to the bathroom. Every morning, same routine, efficient, responsible, harmless, or so he thought. Then one Tuesday, halfway down the hallway, he felt a wave of lightheadedness so intense that the walls seemed to tilt. His heart began pounding. His chest felt tight. He grabbed the doorframe and barely stayed upright. Leonard was terrified, and honestly, anyone would have been. He thought he was having a heart attack. His wife called emergency services. At the hospital, the worst possibilities were ruled out, but the cardiology team found something important. Leonard's heart wasn't failing that morning. His body had been jolted. He had gone from lying flat to standing and moving before his circulation had stabilized. Add mild dehydration, morning blood pressure changes, and medication that made him vulnerable to sudden drops, and that quick rise became a perfect storm. Not dramatic in appearance, but physiologically dramatic in effect. And that is exactly what happens to countless seniors every single day. Here's the part almost nobody tells you. The morning hours are already a higher risk window for cardiovascular events. That is not fear-mongering, it is physiology. When you wake up, stress hormones rise to help your body transition into activity. Blood pressure begins climbing. Heart rate changes. Blood vessels respond. The blood also becomes more prone to clotting activity during the morning period. That combination means the first hours after waking place extra demand on the cardiovascular system. For a younger person with flexible arteries and strong compensatory reflexes, the transition may feel easy. For an older adult, it can be anything but easy. A study in older adults with hypertension found that an exaggerated morning blood pressure surge was linked to a significantly higher risk of stroke. Think about what that means. The very period right after waking is not just another ordinary hour on the clock. It is a time when the heart and brain may already be under increased pressure. So if, during that same window, you abruptly force your body from flat and still to upright and moving, you are adding mechanical stress to a system that is already shifting gears. That morning rush may feel normal, but normal is not the same as safe. Now, before I show you the safer way to wake up, you need to understand what actually happens inside the body after hours in bed. During sleep, you have been lying horizontally for a long time. Your body has not been fighting gravity in the same way it does while standing. Fluids redistribute. Muscles are inactive. You have also gone hours without drinking water, which matters more than most people realize, especially if you take diuretics, blood pressure medication, or have any degree of dehydration. By morning, the body must suddenly coordinate blood vessel tightening, heart rate adjustment, brain perfusion, and balance. That coordination is not instant. When you stand too quickly, blood can shift downward into the legs and lower body before the circulatory system compensates. If your pressure falls suddenly, the brain may briefly receive less blood flow. That is why some people feel dizzy, weak, sweaty, shaky, or foggy right after standing. Some see black spots. Some feel their vision dim. Others feel a strange pressure in the neck or chest, which can be terrifying. This is called orthostatic hypotension, and it becomes more common with age. It also becomes more likely if you are dehydrated, have stiff arteries, or take medications for blood pressure, depression, Parkinson's disease, or heart conditions. Let me tell you about Eleanor, because her story reveals how deceptive this can be. Eleanor was 71 and lived alone. Every morning she woke, stood up immediately, and made a quick trip to the kitchen to start coffee. Several times a week, she would feel a little wave of dizziness. Nothing dramatic, just a few seconds of weakness, a little tunnel vision, maybe a need to steady herself against the counter. She dismissed it. She called it one of those silly aging moments. But one morning, she stood quickly, took 3 steps, and collapsed. She fractured her wrist and hit her shoulder hard enough to need months of physical therapy. What caused it was not clumsiness. It was not bad luck. It was a sudden blood pressure drop on standing, likely worsened by dehydration and medication timing. That is why this topic matters so much. The danger is not only heart attack or stroke, it is also falls, fractures, head injuries, and the chain reaction that follows. A single bad morning fall can take an independent senior and change everything about the next year of life. Mobility changes, confidence disappears, activity drops, then strength drops, then balance worsens. A one-rushed movement before the body is ready can start consequences far beyond that single minute. And here's where things get more complicated, because the morning problem is not just low pressure. It is instability. Some seniors experience a sudden drop when they stand. Others, especially those with hypertension, experience a strong upward surge in blood pressure after waking. That is the part many people miss. They assume blood pressure can only go one direction during a morning transition. Wrong. For some people, the act of waking triggers rising pressure, more vascular tone, and more strain on the heart and arteries. For others, standing too fast causes a temporary crash. And for many seniors, both processes can happen in the same morning window. So when I say millions of seniors still do this every morning, what exactly am I talking about? I'm talking about waking up and immediately launching into motion, not pausing, not sitting first, not letting the body adjust. Just opening the eyes, throwing off the covers, standing upright, and hurrying into activity as if nothing has changed overnight. It sounds simple. It sounds efficient. It sounds disciplined. But physiologically, it can be a shock response. It combines posture change, muscle engagement, balance demand, blood pressure transition, and often emotional activation all at once. And that combination can be dangerous in older adults. There's another layer you need to understand, and this one surprises almost everyone. Researchers have found that platelet activity, which plays a role in clot formation, increases after normal morning activities such as getting up and assuming an upright posture. In plain English, your blood may be more primed for clotting during the very hours when seniors are springing out of bed and rushing to start the day. That does not mean every quick movement causes a clot. Of course not. But it does mean the early morning cardiovascular environment is not neutral. It is active, reactive, and for vulnerable people, less forgiving than they realize. Now add one more ordinary morning habit to the picture: dehydration. After a full night's sleep, many older adults wake up behind on fluids. Cleveland Clinic notes that dehydration can lower blood volume, which can make blood pressure plummet, but it can also trigger hormonal responses that tighten blood vessels and make pressure rise. That is why some seniors wake feeling weak and wobbly, while others feel pounding pressure in the head or chest. The same issue can push different bodies in different directions. And if you get out of bed too quickly before replacing any fluids, you are making the circulatory system work even harder. Let me tell you about Walter. Walter was 79 and taking a water pill for swelling, plus medication for high blood pressure. He also avoided drinking much in the evening because he hated waking to use the bathroom. That meant most mornings he woke up relatively dry. But Walter took pride in being brisk. He would sit up fast, stand immediately, and head straight for the kitchen. Some mornings he felt a pounding in his temples. Other mornings he felt so faint he had to grip the table. He assumed the symptoms were random. They were not. They were the predictable result of a body facing posture change, dehydration, and medication effects all at once. Once Walter slowed the transition, drank water, and waited a moment before standing fully, those episodes became much less frequent. Nothing magical happened. He simply stopped asking his cardiovascular system to perform a full sprint before it had tied its shoes. That is the metaphor I want you to remember. Your body at 70 is not broken. It is just less tolerant of abrupt transitions than it was at 40. When you were younger, you could leap out of bed, stumble toward the bathroom, and your system corrected almost instantly. After 60, and especially after 70, that same habit may trigger dizziness, chest discomfort, imbalance, or dangerous pressure swings. And yes, sometimes the danger is much more serious. If a senior wakes, stands quickly, and then develops crushing chest pressure, pain radiating to the jaw or arm, severe shortness of breath, one-sided weakness, facial droop, or slurred speech, that is not a wait-and-see situation. That is emergency territory. Heart attack symptoms can include chest discomfort, cold sweats, nausea, unusual fatigue, or lightheadedness. Stroke symptoms may include sudden balance loss, changes in vision, arm weakness, facial droop, or speech difficulty. The key point is this: do not dismiss severe morning symptoms as just getting older. That mistake costs precious time. Let me tell you about Marie, because her case shows how easy it is to miss the pattern. Marie was 68, recently retired, and she thought her morning headaches meant her blood pressure medication was failing. Every day she woke, stood up quickly, shuffled to the bathroom, then bent over to wash her face. The headaches hit during that first 10 minutes. Her doctor increased her medication, but the symptoms worsened. Why? Because the problem was not simply uncontrolled blood pressure. It was the violent transition of posture plus over-medication plus dehydration. Once she changed the way she got out of bed and reviewed her regimen with her clinician, the headaches eased. That is why I need you to stop thinking only in terms of diseases and start thinking in terms of routines. Cardiologists do not just care about what pills you take or what your lab values show. We care about the repeated moments that place stress on the heart and circulation, and the first minute after waking is one of those repeated moments. It happens every day, every single day. So even if the risk from one rushed morning seems small, a habit practiced 365 times a year becomes significant, especially when the habit occurs during a period already linked to higher cardiovascular instability. A repetition turns minor carelessness into serious exposure. Here is the protocol I want you to picture. The moment you wake up, do not throw yourself upright. First, stay lying down for a few breaths. Wiggle your feet, flex your calves gently, move your ankles. These small movements help wake up the muscle pumps in the legs, which assist blood returning to the heart. Then roll to your side and push yourself up slowly into a seated position. Sit at the edge of the bed. Let your feet touch the floor. Wait there. Breathe. Notice how you feel. If you are lightheaded, do not force the next step. Let your body stabilize first. After that pause, stand up slowly using something stable if needed. Do not twist suddenly. Do not rush to the bathroom in a panic. Stand, orient yourself, and take a moment before walking. If you have a history of morning dizziness, keep a lamp or nightlight on, and consider having a sturdy chair or bedside support nearby. If you take medications that lower blood pressure, or if you've ever fainted, bring this issue to your clinician's attention. Do not self-diagnose, but do not ignore it either. Morning symptoms are data, and good medicine always starts by paying attention to the data. That includes your routines. Now let me add another piece many seniors need to hear. If you wake up and the first thing you do is head for a very hot shower, you may be stacking one more vascular challenge onto an already unstable transition. Heat can widen blood vessels and worsen dizziness in people prone to blood pressure drops. So if you are someone who feels weak, shaky, or washed out in the bathroom every morning, don't just blame age. Ask whether your sequence is the problem. Fast standing, then a hot bathroom, then steam, then bending over, then reaching up. That's a lot of circulatory demand before breakfast. I also want to say something about toughness, because this part matters emotionally. Many seniors were raised to believe that pushing through discomfort is a virtue. Get up, get moving, don't make a fuss, don't baby yourself. I understand that mindset, and in many areas of life it served you well. But when it comes to morning cardiovascular changes, pushing through can be the wrong instinct. If your body gives you dizziness, chest pressure, unusual breathlessness, or a sense that something is off, that is not weakness speaking. That is physiology speaking. Wisdom in older age often means respecting signals instead of bulldozing past them. Now, some of you are wondering, what if I have high blood pressure, not low blood pressure? Does any of this still matter? It matters enormously, because the risk is not limited to fainting. Morning blood pressure often rises naturally, and in some people the surge is excessive. Studies have linked larger morning surges with stroke risk in older adults with hypertension. So if you have high blood pressure, the last thing you want is to add unnecessary physical stress, agitation, rushing, and imbalance to the exact window when your circulation may already be under strain. Moving carefully is not just for people who feel faint. It is protective for hypertensive seniors too. And there is one more routine error that makes this morning mistake even worse. Checking your blood pressure immediately after rushing out of bed and then panicking over the number. I see this all the time. A senior wakes, gets up too fast, walks around, maybe uses the bathroom, maybe argues with the coffee machine, then straps on the cuff and sees a reading that looks frightening. Of course it looks high. The body has already been stimulated. If you want a meaningful morning reading, there is a proper sequence. Empty the bladder, sit quietly, rest, and measure according to a consistent protocol. Panic readings taken in motion are not useful medicine. Let me tell you about Samuel. Samuel was 73 and convinced his heart was deteriorating because he felt awful every morning between 6 and 7 o'clock. His routine was chaos. He woke to an alarm, jumped up immediately, hurried downstairs, bent to feed the dog, and checked his blood pressure while standing at the kitchen counter. The readings were always high. He became more anxious. That anxiety raised them further. By the time he called his doctor, he was nearly in tears every week. The truth was not hidden heart failure. The truth was a terrible morning sequence. Once he slowed down, rested properly, and measured correctly, the pattern looked completely different. So what exactly should a heart-safe morning look like for a senior? Let me give you the full sequence. Wake up and pause. Move the feet and calves. Roll to the side and sit up slowly. Sit for a minute, longer if needed. Stand carefully. Walk calmly, not urgently. Hydrate unless your physician has you on strict fluid restriction. Take medications exactly as prescribed, not according to fear. Use the bathroom. If you monitor blood pressure at home, measure after you have rested quietly and consistently, not in the middle of morning motion. Then begin the day. That entire process may take 2 minutes. 2 minutes is a tiny price. Now I know what some viewers are thinking, but doctor, I've been jumping out of bed my whole life and nothing bad has happened. Maybe. Or maybe warning signs have happened and you normalize them. Maybe you've had small dizzy spells, brief blackouts in vision, pounding headaches, or a few close calls you dismissed. Maybe your body has compensated so far, but compensation is not a guarantee. Aging changes the margin for error. Arteries stiffen, balance worsens, reflexes slow, medication lists grow. One day, the same habit that seemed harmless for decades suddenly produces consequences. The body does not negotiate with old routines just because they are familiar. And please hear me on this. Not every senior who gets dizzy on standing has a heart problem. Sometimes the cause is medication, dehydration, anemia, nerve dysfunction, or prolonged bed rest. Sometimes it is manageable. Sometimes it is serious. The point is not to diagnose yourself from a video. The point is to recognize that abrupt morning movement can expose vulnerabilities that deserve attention. If you frequently feel dizzy, weak, faint, or have falls, tell your doctor. If you have chest pain, severe shortness of breath, or stroke symptoms, call emergency services. Use information wisely. Information is protection only when it leads to action. Let me bring you back to the central warning, because this is the sentence I want burned into your memory. The thing millions of seniors still do every morning is spring out of bed and rush into motion before their heart, blood vessels, and brain perfusion have stabilized. That is the habit. Not breakfast, not coffee, not getting older. The rushed transition itself. It sounds so minor that people laugh when they first hear it. Then they understand the physiology, and suddenly years of dizziness, headaches, falls, and scary morning episodes start making sense. That tiny slice of time between sleep and standing is not empty. It is loaded. I want you to think about how we treat other transitions in life. You do not slam a cold engine into maximum speed. You do not stand on a ladder that is wobbling. You do not step onto ice without testing your footing. But every morning, seniors with hypertension, artery disease, arrhythmias, medications, dehydration, neuropathy, or balance issues demand instant stability from a system that has just been asleep for hours. We would never recommend that in a clinic. Yet at home, people do it automatically because no one ever told them the first minute matters. But it does matter. More than most people can imagine. Let's go back to Leonard for a moment, because his story did not end in that hospital hallway. After the scare, he changed exactly one part of his routine. He stopped launching out of bed. He began waking, breathing, sitting, waiting, and then standing gradually. He kept water on the bedside table. He turned on a lamp before walking. His wife noticed the change immediately. He was steadier, less pale, less agitated. His mornings felt calmer. And something else changed too. The fear left. Because once he understood the mechanism, he was no longer frightened by mystery. He had a strategy. Strategy turns panic into confidence. The same thing happened with Eleanor. After her fall, she thought she had become fragile forever. But once she learned that her old routine was part of the problem, she stopped blaming herself and started changing the environment. She used a slower rise, kept a stable chair nearby, improved the lighting, and mentioned the symptoms to her clinician, who adjusted part of her regimen. Her confidence slowly returned. That matters because fear after a fall can be as disabling as the injury itself. When seniors understand why mornings feel dangerous, they are more likely to take the right steps instead of withdrawing from life. Understanding is a form of healing. Now let me say something for family members watching. If your parent or spouse says they feel strange in the morning, do not brush it off. Watch how they get out of bed. Ask whether they ever see black spots, feel weak, or need to grab the furniture. Ask whether the bathroom feels like a danger zone. Ask whether they rush because they are afraid of not making it to the toilet in time. These details matter. Sometimes the solution is not another medication. Sometimes it is a bedside commode, earlier bathroom planning, medication review, better hydration, or a safer lighting setup. Caregiving often begins by noticing patterns. Before we finish, I want to give you a final morning checklist so simple you can remember it half asleep. Pause, move, sit, breathe, stand, stabilize, hydrate, then proceed. Pause when your eyes open. Move your feet and calves. Sit slowly at the bedside. Breathe and let the body catch up. Stand carefully. Stabilize before walking. Hydrate when appropriate. Then proceed with the day. That is the protective sequence. If you remember nothing else from this video, remember that. The body does not wake in a single instant, and pretending that it does is the mistake. The correction is patience, not fear. And if you are thinking, I needed to hear this, then please do one more thing besides changing your own routine. Share this with someone older than you, or with someone who loves an older person. Because millions of seniors still do this every morning, and most of them truly believe it is harmless. They believe dizziness is normal. They believe near falls are random. They believe morning headaches are just aging. They believe the pounding in the chest will pass. Sometimes it does. Sometimes it doesn't. The tragedy is that many of those frightening episodes are preventable with one simple change in sequence. Prevention often looks ordinary. Your heart and brain are not asking for much. They are asking for a minute. A minute to adjust to gravity. A minute to stabilize pressure. A minute to restore reliable blood flow. A minute to let the body you've carried for decades wake up with dignity instead of shock. Give it that minute. Respect the morning transition. Do not spring out of bed and rush into motion like the rules of physiology no longer apply to you. They do, maybe more than ever. Take care of yourself, protect your mornings, and I'll see you in the next video.